21 years ago today, on September 15, 1995, the Karl Heusner Memorial Hospital officially opened its doors to the public as the national referral hospital for the country. Since its establishment, KHMH has been mired in controversy and stigma following the deaths of 13 babies from a bacteria and the questionable deaths of other patients at the hospital. But the positive results of medical attention at KHMH far outweigh the negative aspects of the health facility.
I think Belizeans should be proud of what happens within the walls of this institution. And even though, as I say, the noise that is loudest does not reflect what happens in the institution, we have to pay attention to the loud noises. Nevertheless, 21 years, this hospital has been growing and adapting to the needs of the country. And that is very important to understand, because when we started off, maybe there were certain challenges that were infectious diseases primarily, and diabetes, etc. But now we face the complications of non-communicable diseases, such as renal failure, heart failure, and of course increasing evidence of cancers in our country. So we have to evolve to meet the needs of our country, and we have to be there not only when it's trauma and everyone is running and carrying the patient's operating room. We have to be there too in the quiet moments when we have to discuss very difficult and complex scenarios with our patients.
For former Minister of Works Melvin Hulse, who currently sits as a member of the Board of Governors of the KHMH, the celebration held today is heartwarming because he was in government at the time and played a critical role in the development of the hospital. Hulse says that the KHMH is a success story.
I was here opening it as Minister of Works. I helped build it. And so 21 years later, I'm here to see one institution whose purpose has manifested itself insofar that you realize that the Karl Heusner saves more lives than all health institutions in the country combined. Saves more lives, have done a phenomenal job for the grassroots people, the length and breadth of this country. And they, in spite of being able to live on their laurels of how much lives and how much good they have done, when they one mistakes made, as in any part of the world, and you know it, because if you never make mistakes, you're not quality husband, okay? But the fact is that in spite of their tremendous success, 98% success, they are still working hard, make her improve on this, or make her get more equipment, make her talk to the nurses, make her get better mentality, make her get structure, make her get more accountability. Let me be on date on what kind of the right drugs are coming in and to be able to help people. This is a success story.
Today, at its 21st anniversary, CEO of the health institution, Dr. Adrian Coy, says that the KHMH has grown tremendously, now providing services that were once offered only outside of Belize. But Dr. Coy says that there is need for infrastructural renovations.
We had a lot of debt earlier on. We've cleared most of that debt, so I'm very happy to say that. And that puts us in a better position to go and plan forward. Because what we earn, even if they use the model not-for-profit organization, that still is not financially feasible for this hospital. It is not, so we do have to get creative ways in which we can not only earn, but then as we earn, we reinvest. The infrastructure at 21 years is struggling in many areas and has to be addressed. A major investment is necessary, but if it cannot be done on a global scale, then we would have to do that, from a management perspective, from the board perspective. We have to do that in a very strategic way.
Duane, Moody for News 5.